right? Right? Where's the baby grow?
Uterus.
In the uterus right here, yes? Right? Generally, yes? Okay. However, remember when we studied the heart, we talked about here's the SA node, here's the AV node, here's the AV node, Purkinje fibers, all that stuff. And the electrical discharge is supposed to be boom, 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 right? But sometimes out around here, you get hyperexcitable, right? And when you get hyperexcitable, you're wired, you had too many lattes or cappuccinos or whatever, and you get an abnormal beat, and it's called an ectopic foci, right? Ectopic foci. Instead of starting at the SA node, it starts in some tissue around the SA node, right? And it ends up causing PVCs. But anyway, it's called ectopic foci, yes? Well, sometimes the eggs only made it down here and it gets fertilized right here and it implants right there, right? And what is that called?
Endotopic?
Say that again?
Endotopic?
No. Ectopic. ECTOPIC. An ectopic pregnancy, right? Ectopic because it ain't supposed to be there, right? It's supposed to be over here in the uterus where it has room to grow. The lumen of these is about there around your little finger, right? You can't grow a 6, 7, 8 pound baby in a space that small. So what's going to happen to this, by the way? What's going to happen is, almost always, you have a spontaneous abortion, okay? What happens is this grows, there's not enough room, the blood supply gets cut off, and boom, the baby dies. And then, of course, it's going to come out. You're going to have a lot of bleeding usually. They're very common. They're called ectopic pregnancy. All of y'all will talk to a woman that said, oh, I lost my baby, right? This is one of the reasons. My older sister, about 10 years older than me, that had one, right? Now, the good news is there's no reason why you can't have another one. It's healthy. This is an unusual situation. But anyway, ectopic foci, ectopic pregnancy. And this is also, what's the layman's term for that? Tubal pregnancy, right? That's the layman's term. Tubal pregnancy, right? And it's not going to last. It's not going to make it, right? Okay. Okay. Now, I'm going to talk just for a minute about this pelvic inflammatory disease. PID, pelvic inflammatory disease. Okay? Pelvic inflammatory disease. One of the main reasons that ladies can't get pregnant. Okay? What happens is this. Okay? What happens is this. And that is, it's an infection, right? These are open, right? Because the egg's got to go from here, 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 down the tube. These are open, right? So what can happen is, if you have a sexually transmitted disease, that disease can work its way down here to here, into your abdomen or into the tube. It can scar the tubes. It can get into your abdomen and cause infection. And it's one of the main causes of sterility in ladies, not being able to have a baby, okay? Pelvic inflammatory disease, right? Almost always from sexually transmitted disease, okay? We'll talk about on Monday. See, the problem about most STDs, if a man gets an STD, almost always, bam, he knows, oh, it hurts when I go pee. Sorry, not to be crude, right? Ladies, they got plumbing. Many times they have no idea. They have no idea. So it could be months, it could be years, if they're not tested, that this is growing inside of them, scarring their tubes, right? They have no idea, right? Once again, ladies get the short end of the stick, right? Just kidding. But anyway, right? So, we'll talk much more about that on Monday, okay? The uterus, okay? The fundus of the body, the cervix, okay? The uterus is shaped like an inverted pear, okay? And the uterus in ladies is going to get bigger and more muscular, right? It's going to hypertrophy because you got to have muscles to squeeze that baby out. So it's going to get bigger and stronger, right? Now, here's one thing that people don't realize, okay? I'm sure you've all heard of back alley abortions, right? Well, it's very common in a back alley abortion that they perforate the uterus, okay? The reason being is this: if I took a lateral view here, the uterus is shaped like this, okay? It tips forward. This is posterior, this is anterior, right? And when the back alley abortionist is trying to get rid of the baby that's growing in here, right? They're trying to kill it and dig out the contents back here. They don't understand their anatomy that it curves forward like that. Commonly, after you have a baby, maybe all the placenta doesn't come out. And so they have to do a procedure called DNC, dilatation and curettage. And many years ago, I wrapped surgical instruments that they did this with, and they're shaped just like that, so the doctor can put it up through the vagina, up through the cervix, and he's reaching up there and he's scraping to clean that inner lining. But the doctor's trained and he knows this is the shape of it. And people that are not trained, they're thinking that it's straight up and back. They poke a hole in here. Generally, they don't have good sterile technique, and it's common to get an infection. Now, if they're too rough, then many times the doctors can also perforate, and it's very serious. But anyway, maybe leading to an open surgery where they have to do that again. But just realize that from the lateral, it's tipped forward, the shape of it, okay? Okay. Okay, the cervix, right? External os means whole, internal os, right? This is where a woman gets cervical cancer, right here, yes, okay? Now, the mucosa has mucus glands, and it secretes mucus, right? And at certain times of the month, the mucus is thicker, yes? If you've ever, the Catholic Church, there's usually some ladies there that are nurses that teach the rhythm method or whatever, where they look at the cervical mucus. They take a mirror and they hold it down there and they look at the cervical mucus. And that's supposed to tell you when you're more likely to get pregnant and not, okay? But anyway, from the glands, okay? Let's talk about cervical cancer, right? Cervical cancer is caused, for the most part, by human papilloma virus, HPV, right? And let me explain. There's actually, I don't know exactly, about 60 of those different viruses. Actually, human papillomavirus is like a name of a family of viruses, okay? And a few years ago, cancer of the cervix, about 450,000 women a year, and half of them are killed. Half of them die of it, the cervical cancer, okay? Usually women aged 30 to 50, right? Now, why is it that half of them die? Usually ones in third world countries, not in America or Canada, right? Okay, now, Dr. Papanicolaou came out with pap smear, right? They stick their instrument up the vagina and they'll take a little clipping, right, of the epithelium there, and they'll look at that. And they look at it under a microscope. And people, most of the time, they don't realize, okay, that it's not just, oh, this is cancer, this is not cancer. There can be a slow, gradual progression of the cells towards cancer, okay? So maybe this is totally normal, but here you're getting some features. Here you're getting more features of cancer. Here you're full-blown cancer, you see? So they give you like a score or a number. They do the same in the men with the prostate. It's called a Gleason. We talked about that last time. But anyway, but realize that it's not just, oh, that's cancer, or oh, that's normal, oh, that's cancer. Many times it's in between, right? If they're concerned, many times too, they will scrape all the lining of the cervix and let it grow back and then wait so many months and look at it again, and many times that takes care of it, right? Again, this is if you get good gynecological care, okay? What are the risks? Risks of cervical cancer, cervical inflammation, sexually transmitted diseases, okay? And multiple pregnancies too, multiple pregnancies. If you have more pregnancies, then you're more likely to get it, yes? Okay. They have a vaccine now called Gardasil, right? They have a vaccine now called Gardasil and such. I'm not sure about how effective it is. Some people are very pro and some people are very anti. About 15 years ago, Rick Perry was the governor, and he declared, by God, every 12, 13, 14-year-old girl is going to get this, and there was a massive backlash, right? And he came out and reversed that and said, oh, that was a major mistake, and I'm sorry, right? And you got to admire people that say, I was wrong, I screwed up, yes? But anyway, they want you to give it to the 12-year-old girls, right? Now, it's up to you whether you do it or not. If your children are going to be promiscuous, then yeah, you better do it. It's very scary, right? To protect them from STDs. If they're not, I don't know if that's necessary. But anyway, it's up to you to decide. I got a paper, do the reports, and I got a paper on it one time. It was scary, some of the side effects, and even some young ladies had died and such from it. So interesting, but very important. You need to do the research yourself, and not just no. Your doctor says no, you need it. You need it. Here, get this. Then if you have a bad side effect, it's your fault, right? Because you didn't do the research. Because most people are freaking lazy, right? Yes. Talking yesterday about the prostate cancer. Sometime I'm going to have that done because mine's getting too big. And but I assure you, I've done a bunch of research. I know what the treatments are. I know what the best treatments are. I know what the treatments have the least amount of side effects and such. And anyway, yeah, exactly. So and most people are just stupid. They show up and the doctor goes, oh yeah, you're going to have this. You need this. It's a good idea. Well, what are the side effects? Well, I don't know. Just take it. Right? Because the doctor can't get sued because our government has this. Anyway, it's a long story. Okay. Okay, let's talk about. We said, ladies, when they have the baby, when they're pregnant, the uterus gets much bigger and thicker, right? It hypertrophies, yes, and also too, it undergoes hyperplasia. Okay. Now, hypertrophy. I lift weights, my muscles hypertrophy, they get bigger, right? But I don't get a whole bunch of brand new muscle cells. Just the muscle cells I have get bigger. Hyperplasia means brand new cells, okay? Normally when you hear the word hyperplasia, you go, oh crap, because you're talking cancer and you're talking a tumor, right? But in this situation, hyperplasia is fine if you're a young woman and you get pregnant. That just means that you're adding more muscle cells to your uterus, and that's totally normal, nothing to be concerned about, yes? Now, if you have multiple babies, right, and stuff, if you gain especially a large amount of weight, then many times the pelvic floor, the muscles that hold all this up, become stretched and torn in the ligaments, and the uterus wants to drop down, called prolapse, right? Yes, the book says, I guess it can even push down where it pushes into the vagina, and I've even heard of stories where it was coming out. Okay? But anyway, that's when you do a hysterectomy. Okay? Always before they either did the bikini scar or vertical scar and took it out. Nowadays, it's amazing they're getting to where they cut across here and they can do it in the office and pull it out through the vagina. But anyway, you don't have to be in the hospital now for that. Okay? It's common for a woman to have fibroid tumors in here, and the tumors will bleed and bleed and bleed, and that's another reason to have the hysterectomy. Okay? Okay. Okay. Right? The lining is the endometrium. The muscular wall is the myo. Remember myo? M-Y-O means muscle. Myometrium. And around it is the perimetrium. Peri meaning around, right? Okay? The perimetrium, the myometrium, the endometrium, right? The endometrium we'll talk about at the end of the lecture, how it flakes off when a woman has her cycle every month. Okay? Right? Okay. By the way, sometimes they do that hysterectomy surgery robotically, okay, instead of doing it the old-fashioned way. And they use that as a marketing gimmick. Oh, it's robotic surgery. Everybody thinks, oh, wow, that's good. Yeah. Here's the thing, where they cut around here, yes, if you had it robotically, the name of the robot is the Da Vinci, right? Yeah? Yeah, here's the trouble. You're 9 times more likely to have a tear in the cervical cuff, C-U-F-F, if you have robotic surgery. It's way better, in my opinion, to have it the old way, because you don't want to have a second, and you sure don't want to have a third if it tears and won't stay. Oh, but anyway, so don't always think that robotic, ooh, cool, right? That's the best. Again, you need to do homework anytime somebody says he wants to do surgery on you. Right? Yes. Okay. One other thing I was going to mention is, right? One of the reasons, too, that ladies sometimes can't have babies is they have scarring in the tubes, right? And I have a sister-in-law married to my brother that's 4 years older. That's what they told her. They did a test. They inject a dye that shows up on X-ray, right? This and that, and their tubes were blocking this and that. And you know, they told her, well, we're sorry. It's funny. My wife's name is Debbie. Her name is Debbie too. Yeah, and such. And anyway, they told her, well, we're sorry that you're just not ever going to have kids, right? And so, you know, really sad. Yeah, yeah. There's only one trouble. About 2 years later, right, my nephew, Glenn W., CW, was born. About 2 years after that, my niece Whitney was born, right? Yes? When the doctor said, oh, you're never going to have kids. Sorry, you just got to get over it. You know, right? Yes? So, ladies, if I ever tell you you're never going to have kids, don't believe them. Because they don't know, because they're just doctors, and they're smart, but they ain't God, right? So, just realize that, yes? Wow. My nephew GW, he's like a 25-year-old, no, he's older than that, 29-year-old Trump now. He owns like 30 different rent places and this and that, and getting bigger and bigger and bigger. It's just astounding, that kid. But anyway, so, but that's very common. Okay? Now, the word vagina, V-A-G-I-N-A, the word vagina means sheath, right? As in, you know, your sword comes out of the sheath, right? The lining of the vagina has wrinkles like that. And again, you have the same thing in the stomach, and this is called, just like the stomach, I say rugae. I don't know how other people say it, right? Yes? And again, as for gripping the penis, it's curved and causes pressure, right? Now, we also talked about the lining of the vagina is acidic and that kills germs. Okay? Now, very young people, 13, 14, 15, 16, 17, 18, 19, and such, right? Young ladies, their vagina is not as acidic as older women, late 20s and such. And so therefore, they're much more likely to catch a sexually transmitted disease, right? Right? College age, you're much more likely to get STD, okay, than if you're older. But anyway, 2, because it's acid. Do you remember in the immune system chapter we talked about the acid mantle? Our skin is a little bit acid. We eat food, the stomach is full of acid, right? The lining of the vagina is also acid to kill germs. It's called the acid mantle. Mantle meaning like covering, okay? But anyway, that's what I was taught. Okay, it is modified stratified squamous epithelium, right? Stratified, right? There could be some friction in there, and if it was only one cell thick, that wouldn't be good, right? So it's stratified squamous. Squamous, where the outside meets the inside, right? Lining of your mouth, lining of your GI tract, where the outside meets the inside. Vagina, stratified squamous, okay? Okay. Okay, that acidic pH keeps the vagina healthy and free of infections, right? Okay, let me erase some of this. Okay. Right. The vaginal orifice, the skin around here is called the hymen, Hymen. That is torn at the first sexual intercourse. The urethra, right above there, and right above that, of course, is the clitoris. The clitoris is the homologue of the penis. That means that's the equivalent of it, of the male penis right there. It is also erectile tissue, just like the males. Okay? The female external genitalia is called the vulva, the U-L-V-A, right? Now, the flaps of skin that cover it across here are called the labia majora and minora. Labia means lips, okay? Majora and minora, okay? Now, this area in here that is covered, this is called the vestibule, V-E-S-T-I-B-U-L-E, right? Many times when you walk in the front of the building, the entryway is called the vestibule, right? You go into a church, there's a vestibule, then you go into the main sanctuary, right? Okay? Yes? There are glands that keep this moist and such so it doesn't dry out. Okay. Right? The mammary glands next. The mammary glands are modified sweat glands that produce the milk, right? The cells that produce the milk are called alveoli, right? Just like in the lungs. Make sure I spell that properly. Okay. Then you have ducts. By the way, commonly, it's not the alveolar cells that make the milk that go cancerous. It's the ducts. It's very common. It's more in the ducts, right? Okay. Around the nipple, you have the area here, and that is called the areola, right? And there are oil glands on here to keep the nipple from drying out, right? Marathon runners, what do they have to do? Have to put tape on their nipples because the shirt rubbing for 26 miles it's painful and such. It's very common. Okay? Okay. let's talk about breast cancer, right? Except for non-melanoma skin cancers, it's the most common cancer in females. It's the second most common cause of cancer deaths in females. About 13% of women develop it. I don't agree with that. I think it's going to be much higher. I think, like men, if they live long enough, they're going to get prostate cancer. And if you're a female and you live to be 100, you're going to get breast cancer. That's the way it is. But generally, it's much slower growing most of the time. Okay? Now, again, it usually arises in the ducts. Okay? What are the risk factors for breast cancer? Okay? Number one, early, E-A-R-L-Y, early onset menstruation. Early onset of menstruation, late menopause, right? No pregnancies. Okay? First pregnancy, late in life. Okay? No breastfeeding. And family history. Okay? Okay, let's talk about that. Early onset of menstruation, right? When menstruation starts, that's called menarche. That's the technical term for it, M-E-N-A-R-C-H-E, menarche. Okay? Early onset of menstruation, right? Okay? Late menopause. Most women, what's the average age for women to go through menopause?
65.
Okay, a little too high, a little too low. 50. About 50 is the average, okay? No pregnancies, right? Little old ladies that have never been married, never been pregnant, have a higher rate, okay? First pregnancy late in life, yes? Right? It used to be in our society many years ago, you got 16, 17, 18 years old, you got married, started having kids, right? Now ladies are getting their careers going and established and they're 30 and 31, commonly, yes? Much later in life, okay? Later in life, such. No breastfeeding, okay? One of the best things that you can do for the health of your baby is feed them. It's just very simple. That's one of the best things you can do for your health. You don't want breast cancer? Breastfeed your baby at least 9 or 10 months, okay? At least 9 or 10 months, okay? Family history. There are some ladies that have a family history. There are certain genes called the BRCA1 and the BRCA2 gene, right? Oh, by the way, what young woman had a double mastectomy because her mom, movie star, and her aunt both died of breast cancer at a very young age, and her father's name is John Boyd? And she has jet black hair. And she used to be married to Brad Pitt.
Angelina Jolie.
Thank you, finally. Jeez. Right? Her mom and her aunt at a young age both died. So she chose to prophylactically, meaning just go ahead and have them removed. And they immediately did the plastic surgery, right? And put in breast implants for her to prevent that because she had such a strong family history. Okay? But anyway, but most ladies know, but there is a small, about 10% contingent of that, right? Yes? Now, I'm going to tell you one other thing, ladies, that's not in the book, right? But it's just factual, okay? And it's called, our book is politically correct and it doesn't tell you the truth. I think you should hear the truth and decide for yourself, right? That's why I think about it. Whatever you choose to do, but you should at least know the facts, right? Yes. And that is the ABC connection, right? If you have abortion, then much higher rate of breast cancer. If you have multiple abortions, much higher rate of breast cancer, okay? Your hormones are very high, and then after the abortion, boom, they plummet, right? Suddenly. For some reason, that seems to bring that on, right? And such. But anyway, it's up to you. You decide what you want to do. I'm not telling you what to do. I'm just saying, I think you ought to know that, right? It's very serious, lifelong consequences. Yes? But anyway, okay. The signs. Number one, a change in the skin texture. If the skin on your breast starts to look different, if it starts to look, you know what the outside of an orange looks like? An orange peel, the outer part, how it has kind of little dimples or little wrinkles or whatever. Yeah, okay. If it starts looking like that. If the skin puckers and gets wrinkles, right? Gets wrinkles, that's not good. And also too, leakage from the nipple, and I'm sure that's a very late sign. But anyway, that's another one. Okay? By the way, who finds most breast cancers? Not who you think.
Yourself.
Huh?
Yourself.
No.
Mammogram.
Huh?
Mammogram?
A who?
Mammogram?
No. Pardon me? Ultrasound. No. You got to think out of the box. Who's going to find them? Joseph knows.
Men.
Men are the ones who find the breast cancers the most, right? Yes, no, that's quite all right. No need to be embarrassed, right? It's very common. Men are going to find those, right? Yes, right? My wife has some fibroids. I know just where they're at, right? Yes, okay. Yes. Oh, baby, sorry. It's time for your breast chemo. Anyway, okay. But that's very common. Now, is breast cancer more common than it used to be? Okay, how many say yes? 1, 2, 3, 4, 5, 6, 7. Come on, Miss Joan. No. 8. 8. Okay, 8 out of 2, 4, 6, 8, 10, 12, 13. 8 out of 13. Okay. Yes. Now, this is just my opinion, right? The technology that we have now is amazing. The mammogram things that we have now, the machines, is amazing, the technology, okay? And so more and more women are getting diagnosed with breast cancer, but it's a tiny little speck, okay? It's a tiny little speck, but because of the advanced imaging, they can, okay? So I don't believe there's more breast cancer. You hear that all the time. I don't believe that. I believe it's just our technology gets better and better and better and better, right? Okay? They can check your blood for chemicals and they can tell you parts per million, right? Parts per million. You know how tiny that is? Those machines are so sensitive. Well, that's the way these machines are too, right? Now, is that tiny little speck going to turn into major breast cancer? Hard to know. It's very slow growing. It's very slow growing. Don't get me wrong. There are a few that it is very aggressive breast cancers, especially if you carry the genetic, right? So, but anyway, I don't. This is my opinion. I don't think there's. I think there's more and more diagnosis of it, but I don't think there's more of it. I just think they're finding it when it's a tiny little speck, when it would be 25 years later if they did. Yes.
Isn't there a certain age where women have to start going like on a yearly checkup to see if they develop?
I'm glad you asked that. Okay. Years ago, there were guidelines put out by the American Academy of blah, 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 I can't remember. And they had certain guidelines, right? And I can't remember what it was. I don't know if it was after 40 or after 50. They wanted a woman to have a mammogram every year, right? Well, they did a lot of studies and crunched a lot of numbers, and the amount of breast cancer did not go down from that, okay? So they've changed a lot of, it's the same with prostate cancer for men, right? Having them go once a year to the doctor did not decrease that, okay? So a lot of the guidelines have changed and such, right? And we also have to be careful too about anytime you have a mammogram, you get radiation, okay? There's a very eminent researcher, and I forget her first name. I think it's Susan, Dr. Susan Love, okay? She's like 50 years old, drop dead gorgeous with the blonde hair and this and that, and that's her specialty. And she was talking, I saw her on a program talking about how women that have a family history, like when they're 25 and every year we give them mammograms, and she said, and we're giving them cancer because we're irradiating those breasts over and over and over and over again, right? So you talk about that with your doctor, what you think is the best, right? Of course, the breast surgeons are, I get it every time, but anyway, it's real, it's a personal thing. But having one every year, that's, I think that's kind of unwise, right? Because you are getting a dose of radiation, even though it's small, you are getting a dose of radiation every time directly to your breast. It's not like whole body, you go to Rio de Janeiro and hang out on the beach, you're going to get some radiation. That's the way it is. The background radiation there is much stronger than here, right? But if I gave you a free ticket, would you go hang out on the beach and wear your bikini? No? Sure you would. Of course you would. Sure you would. Give you a free trip, you would. Okay, all right. But anyway, that's up for you ladies to decide. But take certain things with a grain of salt, right? Take certain things with a grain of salt and think for yourself and do some research yourself instead of just, this is the party line, this is blah, 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 da, da, da. Don't just take their word for it because they don't have all the answers. And everybody's an individual and such, right? My wife has no history of breast cancer among her grandmother, her mother. Grandmother made 93, her mom's 85 now. No history of breast cancer. So when she was about 50, she had the mammogram, but we haven't since, right? And they said fibroids, and I'm like, well, I could have told you that before you did the test, right? Yes. And so anyway, it's no big deal, right? Yes. Okay. I'm going to ask you ladies another question.